Welcome. My name is Misty Bandy, and I'm a marketing counselor with the Small Business Development Center at Southwest Virginia Community College. I'd like to introduce my coworkers and cohorts and the rest of my team. So Miss Margie Douglas, who is the program manager, and Brittany Clark-Clayman, who is our marketing counselor for the office. The SBDC provides a wide range of business support in partnership with the Small Business Administration, George Mason University, and Southwest Virginia Community College. We partner with industry experts such as Jennifer Rose with VOSH to offer timely, accurate information, and hope you will find value in the resources that we provide. This evening, we are pleased to have Jennifer, the Cooperative Program Director for the Virginia Department of Labor and Industry. She oversees the agency's consultation and VPP division. Her 16 years of experience with the Department of Labor and Industry includes senior and lead safety consultant, consultation program management, and she also is the program director for the enforcement division. Jennifer is an authorized OSHA outreach trainer. She received her BS from Virginia Tech, go Hokies, majoring in industrial service engineering, and her MS from the Columbia Southern University in occupational safety and health. Jennifer is a certified safety professional. She is a professional member of the American Society of Safety Engineers, having served in the past at the Colonial Virginia chapter as the treasurer and the secretary. In order to be respectful of everyone's time, all participants have been muted, but we will have a Q&A session at the end of the presentation. But please feel free to type any of your questions in the chat, and we will get to those at the end of the presentation. So at this time, we'd like to welcome Ms. Jennifer Rose, and we appreciate her carving out time to help us with this webinar today. So we'll turn it over to Jennifer.
Thank you. Good afternoon. I'll get the slides up here. Can everyone see the slides?
Yes, ma'am.
Okay, great. As was introduced, my name is Jennifer Rose, and I'm the Cooperative Programs Director with VOSH. And today I'm going to be talking about the new Department of Labor and Industry standard on infectious disease prevention and the virus that causes COVID-19. If you want to look up the standard in the Code of Federal Regulations, it is 16 VAC 25-220. As we go along here, I'll let you know some various resources where you can find that information and the text of the standard if you are interested in that. There's my contact information. Email is probably the best way to reach me. If at the end of this presentation you have any questions or think of anything after the fact, my email address is on there. And I'll provide this a copy of this presentation, I guess, to y'all so you can disseminate that as necessary. So why do we have the standard and who does it apply to? The purpose of the standard is to prevent the spread of the virus, and it applies to every place of employment within VOSH jurisdiction. Basically, this is any general industry, construction industry, manufacturing within the state of Virginia. We do also cover state facilities, public sector, but we do not cover federal sites, such as like down Tidewater area by the shipyards. The standard specifically recognizes that various hazards or job tasks at the place of employment can be designated as very high, medium, or low exposure risk for the purposes of application of the standard. The standard takes a layered approach to providing employee protection against SARS and COVID-19 hazards and job tasks depending upon exposure risk level. There are minimum requirements that apply to all employers and enhanced requirements for those with medium exposure risks, very high, and high exposure risks. The standard is designed to supplement and enhance existing VOSH laws or standards that are applicable to the COVID-19. These could include things like personal protective equipment, respiratory protection, occupational exposure to hazardous chemicals, and hazard communication. These are all standards in which we already have existing standards, but this the standard specific to COVID has been implemented to enhance those. And should this standard conflict with any existing VOSH rules, the more stringent of the standards shall apply. And we'll get into details about how you can determine what hazard risk level you are in a little bit. So some important dates to remember: the permanent standard was adopted January 27th of this year. July 27th of last year, we adopted an emergency temporary standard. That emergency temporary standard is only available to last for 6 months. So during that 6-month time period, the agency was in the process of developing a permanent standard, just because we knew that the pandemic was continuing on, and we wanted to make sure that we were going to ensure protections for employers. So this new permanent standard was adopted January 27th. They went through a whole rulemaking process and was approved by the governor and then posted in the Richmond Times-Dispatch, which becomes our official publication for the text of the standard. Some important dates from the standard include an employee training requirement and a requirement to have a written response plan in place. Both of these are required by March 26th. We're going to talk about how to protect your employees and actions that you can take every day to help prevent the spread of COVID-19. Some of the things that you can do to protect your employees include things like social distancing, self-monitoring, posting signs in the workplace, as well as offering disposable face masks, personal protective equipment, or face coverings as necessary. You want to make sure that you have cleaning and disinfecting supplies in your workplace and have provided training to your employees on the processes that are involved at your workplace to protect them from COVID. The first step in determining what you need to do in relation to the standard is to determine what exposure risk level your employees are. Lower risk jobs are jobs that do not require contact inside 6 feet with persons known to be suspected of being or that may be infected with COVID-19. These individuals have minimal occupational contact with other employees or the general public, or could achieve minimal occupational contact through the implementation of work practice controls, such as physical barriers or teleworking, not just the use of face coverings. Medium risk jobs require more than minimal occupational contact inside 6 feet with other employees, persons, or the general public that may be or are known to be suspected of being infected with COVID. These can include, but are not limited to, waiters, grocery store workers, agricultural workers, construction workers, hairdressers, workers in manufacturing facilities, things like meat processing, as well as any healthcare settings where they do not have known suspected sources of COVID-19. High-risk category employees are ones that have high potential for employee exposure inside 6 feet. And these will include things like hospital workers, first responders, medical transport providers, medical and dental staff, as well as any non-medical support staff that may be in the facility, obviously, as well as long-term care facilities and home health care workers. But typically the ones that are providing medical care to those infected with the virus. Very high-risk jobs are those that have a high potential for employee exposure inside 6 feet to known sources of COVID-19. These individuals performing specific medical tasks, things that generate an aerosol, or any post-mortem activities on the specimens that are known to have COVID-19. Again, this is kind of going to be a specialized industry. You're typically not going to see this outside of the medical industry. So how do you determine your exposure risk level? First, you want to look at the job tasks that your employees are doing. Are they interacting with the public, or are they interacting with patients in a medical setting? What kinds of things are they doing that are exposing them to potential virus or COVID-19 exposure? You want to look at the work environment. Do you have employees that are teleworking, or are they out on a construction site where they're getting more ventilation, or are employees in an office type setting where they have cubicles? You also want to look at the presence of the virus. Have you already had positive cases in your workplace, or an outbreak, or do you have lots of employees calling in with symptoms of the virus? In determining the exposure risk level, you want to look at the number of employees per the size of the area. If you have a large facility, are your employees able to spread out and have room so they can maintain that 6 foot of social distancing? Or do you have more of a manufacturing facility type exposure where employees are working side by side along a production line? Again, those working distances of 6 or more feet, if they can be maintained, that's gonna decide what exposure level you can put your employees into. You also want to look at the duration and the frequency of exposure. Is it something where you have employees working 12-hour shifts, or is it something that they can come and go in the workplace depending upon what the job tasks you do? And then you want to look at any hazards that are maybe encountered by employees. Is there any potential for airborne transmission in your workplace or any contaminated surfaces? So the standard does have training requirements, which again is that March 26th deadline. Employee training for very high, or medium exposure risks must include the hazards and characteristics of the virus and COVID-19. And the training must enable each employee to recognize the hazards of the virus and any signs and symptoms of COVID-19. You want to make sure that you train each employee in the procedures that they are to follow in order to minimize the hazards. Training must include the requirements of the standard, characteristics and methods of the spread of the virus, awareness of transmission and how the virus is transmitted in the workplace, as well as any safety and health work practices, things like social distancing, disinfecting, non-contact methods of greeting, things like that. Training should include any requirements for personal protective equipment if it's required based on your exposure risk level. You want to look at how to put on and take off personal protective equipment, the usage of it and limitations of it. This comes into play when you're talking about face coverings and making sure that employees understand that face coverings are not as effective as personal protective equipment, things like surgical masks or N95 respirators. The training also should include a statement about anti-discrimination. The standard has an inclusion of a section on anti-discrimination where employees should not be discriminated against for bringing up their concerns about exposure in the workplace. And this is similar to anti-discrimination laws with any other hazards in the workplace, things like that, if an employee brings to attention a concern with machine guarding or some chemical exposure. This is the same thing, that they are protected from discrimination in their workplace. And then lastly, the training program should include elements of your infectious disease preparedness and response plan. Again, for that very high, or medium risk, they are required to have this plan in writing. And you'll notice this training is only required for the very high, or medium exposure risk levels. Those employers with employees in the lower exposure risk level do not necessarily have to provide a full-on PowerPoint full presentation. They are allowed to just provide them general information. And both the training program as well as the low exposure general information, we actually do have, we've provided this on our webpage, a copy of a training program that is suitable to meet the requirements of the standard. This program that I'm providing today does not meet all the requirements of the standard, just because it does have to be made site specific to your workplace and include things like the processes that employees are to use to report their symptoms or to return to work, things like that. So that the training program that is on our webpage is available for use by those very high, or medium exposure risk level work sites. Some requirements to consider in your workplace are the use of sick leave, teleworking, or staggered shifts. And you want to make sure that you provide a policy and procedures for employees to self-report or monitor any symptoms, and then reporting positive test results. How are your employees supposed to report that to your workplace, through their supervisor or through an occupational health program? The standard also requires notification to both the Department of Health as well as the Department of Labor and Industry. Any positive cases, anytime you have 2 or more positive cases in your workplace within a 14-day period, you are required to report that to the Department of Health. If you have 3 or more positive cases within a 14-day period, you're required to report that to the Department of Labor and Industry. In order to report these, we do have a portal on our webpage where not only the VDH, but also Department of Labor and Industry gets reports of these positive tests. And like I said, 2 or more for VDH and 3 or more for Department of Labor and Industry. And I'll include that link at the end of this presentation. One of the things to also notice or to be aware of as far as notification goes, if you are in a facility that where other employers are working, or you have a building or facility owner other than your employment, you want to make sure that the facility owner notifies all employer tenants in the building when 1 or more cases have been discovered. They also need to let you know the floor or work area where the case was located. The identity of the positive individual has to be kept confidential in accordance with ADA requirements and any other federal or Virginia laws. And you also want to consider a return to work procedure. And we'll talk about that when we get to the written plan. But you want to look at, if you do have those employees that have tested positive, how are you going to safely return them back into the workplace? So in doing a hazard assessment, you have to look at if your employees are required to wear any personal protective equipment, or you have to have any engineering controls in place. Basically, you want to look at any hazards in your workplace, doing that exposure assessment, doing a walkthrough, seeing where your employees are vulnerable to be, are susceptible to contracting COVID. And you want to then selecting personal protective equipment if necessary. Face coverings are not considered personal protective equipment, and we'll talk about that a little later in the training. So steps to perform this assessment, which is required of all employers to determine their exposure risk level. Step 1, you want to make sure that you inform any affected employees of the process. You want to make sure that you have involvement from the employees in the work area that you are assessing. They're a good resource because they're the ones who are exposed on a daily basis, and so they know day to day what it is their exposures are, and are a good resource when doing that assessment. You want to review any data. Have you had any reports of COVID outbreaks in your workplace, or do you have employees that are experiencing symptoms? You want to make sure that you add that data into your assessment. And in doing that walkthrough survey for the assessment, the purpose of that is to identify any sources of the COVID-19 to employees. You want to look at the layout of the workplace, where employees spatially are in that workplace, and as well as any work operations that they're doing. The next step in doing the hazard assessment is to determine the hazard risk level. Again, there's 4 hazard risk levels, with the very high exposure risk typically being in those medical facilities where they're doing the aerosol generating procedures. The high exposure risk are jobs with potential for exposure inside 6 feet to known or suspected sources of COVID-19. And again, this is typically what you'll see in the medical industry or the healthcare delivery and support staff. Medium exposure risk are, again, jobs that require more than minimal occupational contact within 6 feet of other employees, persons, or the general public who may be infected, but who are not known or suspected to be infected with the virus. Examples of this medium exposure risk level are schools, high population density work environments, things like manufacturing processes, any high volume customer facing retail settings, things like grocery stores, restaurants, bars, and as well as any mass gathering venues, things like sporting events or movie theaters. And then lastly, those lower exposure risk levels, again, are jobs that do not require contact inside 6 feet with persons known to be or suspected of being infected with the SARS virus. Employees in this category include things like remote workers, obviously those teleworking that are home during the pandemic, as well as any office workers who do not have contact inside 6 feet with coworkers, customers, or the public. And once you've determined your exposure risk level, you want to look at what controls you're going to put in place to protect your employees from COVID-19. You want to look at any engineering controls, things like physical barriers. Are employees in cubicles or in offices, or can you put up physical barriers between you and the public? You want to look at any administrative controls, things like altering job shifts, or can you have, some people telework on odd days and some telework on even days. There's any administrative controls to reduce your exposure in the workplace. And then lastly, you want to look at any PPE that may be necessary, or those areas where it's required to have face coverings. In doing this assessment, you do need to make sure that it is a formal written document. We have a hazard assessment on our webpage as a template that can be used by employers. You want to start there with that description of the hazards, looking at each of your job tasks individually and seeing what hazards they, where they're going to be exposed potentially to the virus. And then you're going to include what engineering or administrative controls you're going to put in place to protect them from those hazards. And then lastly, any personal protective equipment. And based on this, you're going to determine the appropriate hazard exposure risk level, either that is very high, high, medium, or lower, based on the definitions. And each line of the hazard assessment is specific, should be specific to job task or job category. Sometimes you may have it specific to employees, depending upon what job tasks they're doing. But if you have, say, several facilities that are all doing the same job task, you are allowed to just have this one general hazard assessment that could apply at each of those facilities. Or the same with if you have job categories where all the employees are doing the same job task, you would just have to have one line item in there for that. There may be situations where you have some employees that are doing low hazard work while some employees are doing medium exposure risk level work. So you do want to take that into consideration when you're doing the hazard assessment. Once you've done this formal written hazard assessment, you want to make sure that you make the document accessible to employees. This can either be done electronically or as a hard copy. And the copy does need to be signed and dated by the person that completed it. And then the last step in this assessment is to make sure that you reassess the workplace as necessary. If all of a sudden you have an outbreak or you have more employees expressing that they have symptoms, you may need to go back and look at that exposure risk level to see if something may have changed, or if they're doing something that you may not have considered. Again, this assessment is available on our webpage, and I'll include that link at the end of our presentation. So one note on face coverings. Face coverings are not considered to be personal protective equipment per the standard. The standard does define face coverings as anything that covers it must completely cover the nose and mouth. It has to be at least 2 layers, and they have to be washable. There should be no exhalation valves or vents, and this is important. I think at the beginning of the pandemic, we saw a lot of manufacturers coming out with the N95 respirators, which technically are not, they're not the medical grade N95 respirators, but several of them had exhalation valves on them, which basically that's the equivalent to not wearing a mask, because you have the employees expelling air through those vents. One thing in the definition we do allow is neck gaiters. There was some discussion on this originally, but in switching from the temporary standard to the permanent standard, we did specify and further define face coverings to allow for neck gaiters to be used. Face shields are not a substitute for a face covering or obviously a surgical mask or respirator, unless a medical condition prohibits the use of that face covering. The standard has a section on social distancing, and actually the standard, instead of using this term social distancing, we use the term physical distancing in the standard, so you'll see that that used interchangeably. Obviously, everyone who's, we've been through the pandemic, we understand that social distancing, the safe distance, is 6 feet away from others. For physical distancing requirements, you want to make sure that employees observe physical distancing at all times on the employer's property. And you should have policies and procedures in place that either use verbal announcements, signage, or visual cues to promote that physical distancing. You want to look at the potential for decreasing work density by limiting non-employee access to the place of employment or restricting access to only certain work areas in order to reduce the risk of exposure. You want to look at physical distancing in common areas, things like break rooms and lunch rooms, and consider whether or not you have to control those, control access to those, or even potentially close them. Some of the requirements in the common areas, the standard does require that employers include a posting at those common areas, again, things like break rooms and lunch rooms. And the posting has to include those four things listed there. It has to include the occupancy of the space. So basically, how many people can you have in that space based on the size of it and allowing for that social distancing of 6 feet between others. The physical distancing reminder, again, just to make sure that employees are aware of the fact that they should be maintaining that 6 foot distance. The posting should talk about washing or sanitizing your hands. Again, a reminder to employees, if you have sinks available, if not, if you have hand washing stations in the workplace, they should be reminded to use those. And then the posting should also include any cleaning or disinfecting procedures that you expect the employees to follow. And when we discuss cleaning, you want to look at those high touch areas. Things obviously in break rooms, if you have tables and chairs where multiple employees could be using them, but you also want to look at things like door handles, light switches. If you're in a manufacturing facility, you may have pallet jacks or other equipment where people are handling them. Multiple people are handling them during the shift. One other thing for break rooms, typically that we often see that is overlooked are vending machines. If you have a lot of people using the vending machines, that there's potential for those high touch areas to be infected with the virus. EPA has put out a web page listing the disinfectants that are suitable against the SARS virus. One difference between the emergency temporary standard and the new permanent standard is that we are allowing equivalent disinfectants to be used. So those equivalent to EPA, not just strictly the ones that are listed by the EPA on that webpage. The requirements in the permanent standard are that the workplaces be cleaned at a minimum once during or at the end of the shift. And if you have multiple shifts throughout a 24-hour period, you want to make sure that the cleaning and disinfecting is done no less than once every 12 hours for multiple shifts. A big part of the standard talks about the infectious disease preparedness and response plan. Employers in exposure risk levels very high and high must develop a written infectious disease preparedness and response plan. This is also a requirement for medium employees. If they have 11 or more employees, they do have to have that written infectious disease response plan. The plan and the training requirements will apply to the very high, and medium. Again, like the lesser training requirements for the lower risk employees, there are lesser requirements. You do not have to have that infectious disease preparedness response plan in writing. And employers are required to designate a person to be responsible for implementing that plan. There is, again, on our webpage, we have a template preparedness and response plan. It is pretty boilerplate, but basically if you follow along that, it coincides with each of the requirements in the standard, and it sort of guides you through development of the plan by allowing you space to incorporate what it is that you're doing in your workplace, specific procedures for reporting symptoms or for returning to work or cleaning, all those things that we'll talk about that have to be included in that plan are included in our template plan on the webpage. So the plan must include the name or title of the person responsible for administering the plan. This person should be knowledgeable in infection control procedures and practices as they apply to your specific facility or your operation. Similar to doing the assessment, you want to make sure that you involve employees in the development and implementation of the written plan. You want to consider and address all the levels of risk that are associated with the various operations in your employment and the hazards employees are exposed to and the job tasks that they perform at your site. The plan should also include where, how, and what sources of COVID-19 might employees be exposed to at the workplace. This can include interactions with general public or customers, or in a hospital setting with patients. And you want to look at whether they are having this exposure to either known or suspected to be infected in persons, which obviously that would put them into that higher risk level. And we also talked about that instance where you could have employees that work more than one job, or you have jobs that are in different exposure risk levels. Your written plan should accommodate for those. But again, like I said, for those lower risk employees, you don't have to have the response plan, but you do want to make sure that if you have any employees that fall above that lower exposure risk level, then you do have to develop and implement this written plan. The plan should also talk about whatever control measures you have in place based on that exposure risk level. What engineering, administrative, or work practices do you have in place that your employees must comply with in order to be in accordance with the standard? The plan should consider any contingency planning for situations that may arise as a result of outbreaks in the workplace. These could include things like increased rates of employee absenteeism, or the need for physical distancing or staggered work shifts. You might need to downsize operations or deliver services remotely. And there should be some options for conducting essential operations with a reduced workforce. This could include cross-training employees across different jobs, or basically doing anything that you can do to maintain your workflow with fewer employees and continue those operations. The contingency plan should also look at the potential for interruptions in supply chains or delayed deliveries, and how may that affect your work processes. The written response plan should include details on how you expect employees to return to work after they've been out on isolation or quarantine. Employers should develop and implement policies and procedures for employees known or suspected to be infected with the virus when they return to work. The standard does provide some guidance on when employees are able to return to work. Symptomatic employees who are known or suspected to be infected with the virus are prohibited from returning to work until all three of the following have been met. 1, the employee must be fever-free, which is less than 100 degrees, for at least 24 hours, and this is without the use of fever-reducing medications. They have to have an improvement in any respiratory symptoms such as cough or shortness of breath. And it has to be at least 10 days past since the symptoms first appeared. The plan should also include basic infection prevention measures that are to be implemented at your workplace. You should promote frequent and thorough hand washing, and included in this requirement should be employees, customers, visitors, general public, anyone that is coming into your workplace that may introduce that virus to the workplace. You want to make sure that they have a place to wash their hands. And if soap and running water are not immediately available, you need to provide hand sanitizers. The plan should include how you are going to maintain a regular housekeeping practice, and this will include routine cleaning and disinfecting of surfaces, equipment, or other elements of the work environment that could become contaminated. And the written plan should include policies and procedures for managing and educating visitors to the place of employment. So if you have the public coming in, what sort of postings do you have to make them aware of what the requirements are in your workplace? The plan should provide for the prompt identification and isolation of known or suspected to be infected with the virus employees. You should address infectious disease preparedness response with outside businesses as well. These could include things like subcontractors that may enter your place of employment, or talk with any businesses that provide contract or temporary employees to your work site. And you want to look at reporting requirements. You want to talk about in your written programs to talk about how you go about reporting that, not only from the employee to the employer, but again, also the requirements for reporting that to Department of Health as well as Department of Labor and Industry. One part of the standard allows for employers to follow CDC guidelines in lieu of the requirements of the standard. And basically the reason for this is because the CDC guidelines can sometimes change. We found this in the beginning when we adopted the emergency temporary standard. About a week later, CDC changed their requirements about traveling, and then the 14-day quarantine period. They also changed requirements about the having employees return to work after 14 days versus the 7 with a negative test, or 10 days. So as these guidelines change, we want to make sure that we make accommodations for that. So the standard does allow for employees to comply with the CDC guidelines. If you are doing this in your workplace, you want to make sure that you have those guidelines available to anyone who may ask for them. You need to know the specifics of the guidelines, with the dates they were issued, things like that. So if it ever were to come to question where we had a officer, a Department of Labor and Industry officer, come to your workplace and question you on what it is that you're doing for your employees that may be different than what's required in the standard, you want to make sure that you let them know of what those CDC guidelines are that you are following. The plan should talk about any Virginia executive orders. Executive orders are separate from these Department of Labor and Industry regulations. Our regulations apply specifically to that employer-employee relationship. They are not for the public, except in the cases where the public may be entering your workplace and may be under the requirements to follow different processes that you have in order to protect your employees. Mask mandates, for example, that come from the governor, may be changed by the governor, but are not going to change based on this standard. If for whatever reason the governor's state of emergency expires, the Department of Labor and Industry has 14 days upon the expiration to meet with our Safety and Health Codes Board to determine whether there is a continued need for the standard. So there is potentially an expiration date on this standard, depending upon how the pandemic goes. Here are a bunch of resources, some of the ones that I talked about throughout the presentation today. First, I'll talk a little bit about our VOSH consultation service. This is a free service offered to employers with less than 250 employees at their work site. You can request a consultant to come out to your site. We are doing virtual visits as well, where the employer will come out to your site, look at any hazards, look through any written programs, policies, help you do an assessment for COVID-19, make sure basically that you're in compliance with not only the COVID-19 standard, but as well as any other workplace standards. There are no penalties or fines related to anything that the consultants find. There's no citations issued. Basically, your only responsibility is to correct the hazards that the consultant finds. That webpage right there lists in detail more about the specifics of the services that we offer, as well as a request form that you fill out online, and that actually comes into me, and we distribute that to one of our 11 consultants around the state. The second link there is for our outreach documents. We have developed from our Department of Labor webpage, we have a specific COVID-19 link. There you'll find the text of the standard. You'll find sort of the whole history of the standard, all of the different Safety and Health Codes Boards meetings we have held, any public comments that have come in during this public comment periods. And then the biggest portion of that is the outreach, education, and training documents. Here's where you'll find the hazard assessment template, the written plan assessment, or the written plan template, as well as a PowerPoint presentation that you can use, again, that meets the requirements, the training requirements of the standard. The link, if you do have those three or more cases, positive cases in your workplace, the link there for reporting that. Again, it's a portal maintained by the Department of Health, but it is linked on our webpage, and both Department of Health as well as the Department of Labor receive those reporting, so there's no need to double report to both of those agencies. We've also developed a COVID-19 specific email address. So if you have any questions, either on things that are on the webpage or specific questions about the standard or how to apply it in your workplace, you can directly email that. We have several of our directors that monitor that email. So it's usually a pretty good, quick response on that if you have questions. You do have my email address, so if you have any questions on anything that I talked about today, or if you need more information, feel free to email me. And I think, like I said, I'm going to provide this presentation to y'all so you have access to that at the end. Are there any questions?
I have a few questions, Jennifer.
Okay.
Thank you. That's great information. It's a lot of information, and I think the website's going to be very, very helpful for them to go and be able to pull that. First question is, if a business owner has those COVID cases and they've reported them to the local health department, do they still need to go and report those to further to other departments also, or will the local health department take care of those reportings?
It does have to be reported through that that portal online.
Okay, so they still need to go beyond just the report to their local health.
Correct, and actually, those reports will be distributed to the local health department. So that actually should be their first stop in reporting is to that web portal, and then it'll get disseminated to their local office.
Okay, so the local office doesn't report. Okay, all right, thank you. Another question is, once the business owner develops this plan, this written plan, do they need to submit that anywhere, or is it something they just keep on site in case they
you
have
just have to keep it in your workplace. It has to be accessible to employees. It can either be in electronic form or written form, but basically that is just a document for your work site.
Okay. And the online training, do they get a certificate with that whenever they
there is a document for a certificate that you can print out. You don't necessarily have to do that. The document on there that says certification of training is more of just a log to include the names of the employees who received that training.
Okay, so it's
nothing. Yeah, it's nothing. You would be the ones providing that training. We provide you the PowerPoint, but you as the employer, or you can contact one of our consultants, can come out and provide that training to you, but the agency doesn't issue a certificate for that.
Okay, so this should be part of their onboarding with new employees.
Yes, obviously with new employees, as well as then any existing employees who have not already had the training from the emergency temporary standard.
Okay.
So they do have to have the training by March the 26th?
Correct.
Okay.
And for the VOSH the consultation, how long does that usually take if a business owner wanted to get the consultation or get someone to do the training for them? What is the backlog on that?
Depending upon what region you're in, it could be a week, it could be 3 weeks. It really just depends upon what region you're in. Some regions are busier than others. Some regions we have more consultants than other regions. So it really just depends upon what region of the state you're in. But they'll contact you, as soon as we get the request. I will get that out to our consultants, and they'll contact you immediately to set something up.
Jennifer, what is the penalty for not having things by March 26th?
And just for clarification, for the written plan, that's for the very high, the high, and the medium with 11 employees or more.
Correct. It has to be written.
Okay.
For medium, just all medium employees have to have a plan, but it doesn't necessarily have to be in writing. It can be something that you've just verbally trained your employees on, or it doesn't have to be in writing if you have 10 or fewer employees.
Okay. But the training is required for all levels of risk, correct?
For the very high, and medium, you do have to have the full-blown PowerPoint, classroom, virtual training. But those lower risk employees, you can just provide them with the document that's on our webpage. And actually, I think it's titled Lower Risk Training. It is just a one-page handout that talks about the general background of COVID and how you're going to implement the controls in your workplace.
I had one question. I think I missed where we get the training at. It's on what website?
It's on the second webpage here on the screen, the Outreach, Education, and Training. It's
Okay.
a link from our main Department of Labor and Industry webpage. If you scroll down about halfway through, we have a big announcements page, and that actually will link you directly to the outreach page as well as to the reporting page.
Okay. And also, I'm in home health and we already have like an emergency preparedness plan for Medicare. Will that kind of take precedence over the one that they need for the preparedness response plan?
From what I've seen for the requirements for home health care, they are pretty similar. I would still recommend that you take the plan that you currently have in place and compare it to the requirements, the specific requirements in the standard for the written plan, though that's required by our standard.
Okay, great. Thank you.
Jennifer, did I hear you answer the question if there is a penalty or what the penalty might be if they do not have the plan by March 23rd or
Right.
23rd?
This a violation of any of the requirements of the standard could be susceptible to citations and penalties, just as any other standard that we have that's required of employers. You know, penalty amounts really differ from they are very case by case specific. Meeting deadlines sometimes is more like paperwork type citations, which typically will have lower penalties or sometimes no penalties at all. But again, it is penalties are on a case by case basis. Sometimes you'll hear in the media sort of a fear mongering that you could be assessed a $13,000 fine, which that's true for violations of very high gravity, high serious issues in your workplace, things like 20-foot falls or being caught in machinery, things like that. But again, it is a case by case basis, but typically what we're seeing are for not meeting dates or not meeting, not having things in writing, things like that, they're going to be those lesser citations, so lower penalties.
If a client or a business owner does decide to want to have a consultation and it's virtual, what is the inspector looking for? What are they going to need to provide at that time to have ready for them? Because I know it's a different world with doing virtual and on site now.
It basically we're running our virtual consultation visits just as we do our normal visit. It has to be at the request. We actually have to have a request form from the employer. Our consultant will contact you and schedule something and do an opening conference where they'll sit down with, any management that wants to be involved in that, any employees, and they'll talk about what it is we'll do. And basically, if you want it specific to just COVID-19, we can do that. Or if you want, more general topics to cover everything in your workplace, we can do that as well. They'll probably start by looking at your OSHA 300 logs, asking questions about any outbreaks or positive cases that you've had in your workplace. And then they'll look through the written plan and, they can also, if you don't have a written plan in place, they can help you implement this and look specifically at what exposures your employees may be present in your workplace and walk you through that too. So that's you don't necessarily have to have everything in place before the consultant gets there. That we can help you kind of guide you along the way on that.
What is the department doing to make business owners aware of this deadline? Because we need to, as the SBDC, of course, be putting out as much information as we can. So is there anything that they're marketing to business owners to make them aware that this deadline exists?
We do have social media. We have Facebook. Our biggest way to get that out is our webpage. I know every time the governor gets on a press conference, he's mentioning something about it and talking about Dolly. So usually we direct everyone to our webpage just because that's where we're keeping the most current up-to-date information. We don't really do any, we have a email list that we go out to sometimes. Press releases will go out to this list and also obviously to other media outlets. We have not yet sent out a press release on the permanent standard. We did one back in July when the temporary standard went into place. I'm not sure whether or not we're gonna do that. I haven't started working on it yet. We're kind of waiting to see as far as that goes. But basically, the requirements of the training and the written plan, we're not really, we don't have any dedicated efforts to that other than just getting the word out that the temporary standard has now become permanent.
And I have one last question about specifics. A funeral home, where would they fall in the risk category?
They could fall in that high or very high, depending upon whether or not they're dealing with bodies of people who have died of COVID-19. Because if that is the case, any postmortem activities could put them into that very high risk level.